Now, the Gift of the Givers is stepping in to help the people of Touwsrivier in the Western Cape. It's noticed a serious lack of medical supplies at a clinic in the small town. Now, that means even something as simple but debilitating as a toothache can go untreated for weeks. Our reporter Nobesuthu Hejana is following developments around the small town and the clinic involved and joins us now for the very latest. No doubt a lot of appreciation for community members as well as those who work at the clinic for what Gift of the Givers has been able to provide to them, Nobesuthu.
Certainly, Rafua. In fact, we out here outside a school which has been converted into a medical facility this morning to assist the community. Over the morning, we've also heard from residents or patients who use that particular clinic. That is the only one that's functioning in the area, but they were complaining about the services, like they would go to the hospital, but they would wait there up until 4 o'clock. Some will be turned home without getting any assistance. But I'm now joined by Mr. Rashad Baker, who is a community activist. Rashad, this morning we're seeing the assistance from the Gift of the Givers. For us who don't know the frustrations from the community, paint us a picture about how bad the medical facilities are around this town.
Okay, Touwsriver is a town that's sitting with an unemployment rate of just over 95%, which means people don't have work. So people can hardly travel to Worcester because that's the only place where there's real doctors, dentists and stuff, because none is existent in Touwsriver. And they don't have the money to do that. So people suffer as a result of that. You have a dentist that comes here once a month. And most of the times you only see school children, which means the rest of the community will still have to suffer, irrespective if it's got a toothache or not. You must wait till, if there is a appointment available, and it can take up to 3 months.
And you were also telling me that doctors who come here, they have to see or prioritize cases. So what have you been doing in ensuring that you engage local leaders to assist the community?
Okay, what we have happened, because we have reviewed what has happened over the past year, and nothing much has changed where the medical services is concerned. So we started in engaging local government, our local councillors, and other people that does play an impact and a role in this town, so that we can get to a workable situation where people can actually get the service that they need. Having Gift of the Givers here today is a godsend, because now people can actually get the services that they normally can't get at the clinic. The clinic has limited resources, only 2 doctors, and they have to prioritize who they see and who they can't see. That's why people wait 3 months up to 6 months for appointments and stuff. And if you need specialist service, you unfortunately have to go out of the town, and people can't afford it. We have people dying as a result of not being able to get the necessary medical assistance that they need. And we can be sitting with a problem that there's no ambulances really available for us. You wait up to 4 or 5 hours for an ambulance to arrive. And when you get to the hospital, it's even worse, because now you have to wait additional 5-6 hours to be assisted. And I mean, that's not fair on our people. We're all human, we all have our own dignity, and we need the services that we deserve. Government needs to come to the party. Gift of the Givers cannot continue doing their work for them. Yes, Gift of the Givers does bring relief in communities, especially in the Touwsriver community, because they have been supporting us for the past year. And today is the ultimate in reaching out to us, because today we could actually assist not just the people of Touwsriver, we could also assist people from the surrounding farms that never get a chance to get to the clinic or see a doctor, as well as people as far as Laingsburg and Matsisfontein.
Thank you so much, Rashad. Rafua, I also want to bring in members of the community, Uncle and also Miss there. Sir, can you just tell us, obviously we've heard from Rashad, the community activist, talking about some of the frustrations from your side, not having enough medical facilities to assist. Today you're here. What exactly brought you here? What assistance are you seeking here?
Okay, what assistance I'm seeking here today is dental surgery. Okay, what is happening here is you go to local clinics and stuff like that, then you have a waiting period of about 2 to 3 months before you can get tooth removed or something like that. Yeah, and that is very frustrating, because tooth is a thing like if it's there, then you have to remove it quickly. Yeah, and it's 90 kilometers to Worcester or whatever to get to a dentist. You have to use taxi money and all that kind of things, to get medical service, And I want to thank Gift of the Givers for what they're doing today, because we're waiting from early hours of the morning, like 5 o'clock, 6 o'clock in the morning, we wait here. And I think the waiting is good, and that we, and we can only thank them and thank God for what they're doing for us here. Thank you very much.
Thank you, sir. Ma'am, also want to bring you in. You came with your child. They were crying inside because we've noticed a lot of children here, they suffer from dental issues. Why are you here this morning?
Right, I'm Helen Berg. I'm here with my son here to seek medical dentist here. So I come here to remove one teeth for me. The reason for that is we go to the clinic here, and then they give us a list, a waiting list. But they take more or less 2 to 3 months when they get to that list, or your name perhaps. So if you want to seek then private help, then outside in the Dorans or Worcester perhaps, then you have to pay for example, in the Dorans, it's $190 per teeth. So I don't have that kind of money, and you have your taxi money, you want to eat for the day. So obviously, because I'm unemployed at the moment, because I was working here at CTE, in Touwsriver commuter transport engineering, but apparently it closed. So we're waiting on Praza for work orders, and then unfortunately, it's not that I am not put my CV in, it's just you don't get work here in Touwsriver, and that's the problem. So today I'm very grateful that there are people that are actually helping us, like Gift of the Givers, so that we can seek medical help from them. And for him, he have one tooth that they remove it, and it really spare me a lot of money today. I'm really grateful. Thank you very much.
All right, thank you very much, ma'am. Well, Rafia, we heard from the lady that we just spoke to and the gentleman speaking before her that they're very thankful to what the Gift of the Givers are doing in the area. We did try to get a comment from the department, the Provincial Department of Health, and they did say that they are working with organizations like Gift of the Givers to sort of bring relief to these communities. Obviously, like we heard from Dr. Imitia Suleiman earlier, that government cannot do it alone, so they are here to assist in this community, and that is going to be what they're doing right now, is a survey from what Dr. Suleiman said. So they will assess and check if this needs to be done, whether like they can continue coming here to assist, or they need to, it's just a once-off thing. But with what they've seen here, they will then give the report back to the Provincial Health Department so that they can see how much of assistance is needed in this community.
No, absolutely. Organizations like the Gift of the Givers are absolutely essential, especially when it comes to the government shortcomings, when it comes to providing basic services and needs to community members. eNCA's Nobesuthu Hejana, thank you very much for your time this afternoon following that story in Touwsrivier.